From the nation's capital in Washington, D.C., the Congressional Report, with your host, Iowa Congressman Tom Latham.
This country is based on farms, on small businesses, and creating jobs and opportunities. That is the lifeblood of this nation.
And now your host, Congressman Tom Latham.
Hello, and thank you for joining me. The earthquake that ravaged Haiti earlier this year has taken a massive and heartbreaking toll on one of the most vulnerable countries in the Western Hemisphere. Reports of splintered families and orphaned children have become all too common in the aftermath of this tragic national disaster. But the outpouring of support and generosity from private citizens and governments from around the world has brought some hope to Haiti and its people. Joining me today to talk about Haiti is Roger Lowe of the American Red Cross. Welcome and thank you for being here, Roger. Tell us a little bit about yourself. How did you go to work for the Red Cross?
Well, Congressman, thank you for having me. My background is I spent 20 years as a newspaper reporter for another Midwestern, papers from another Midwestern state, the great state of Ohio. I worked here in Washington, and then about 10 years ago, I did some public relations work and joined the Red Cross about a year ago. It is the dream job of a lifetime for me, but I can tell you that the Haiti earthquake was my welcome to the Red Cross moment.
Well, March is Red Cross month. Tell us a little. What does that mean?
Every year, the president proclaims March as Red Cross month, and we see it as a time to remind people of the fact that the Red Cross is a congressionally chartered institution. We have a responsibility and a role in disaster response, and we take that very seriously and fulfill it. What we do during Red Cross Month is to remind people of what the Red Cross does, as we talked about here in terms of across the world, around the world in places like Haiti, across the country, whether there are disasters such as the floods in Iowa a couple years ago, or hurricanes or wildfires. Or down the street, whether there's a local house fire that the local chapter responds to, and it's a chance to remind people of the work that the Red Cross does, and we're encouraging people during Red Cross Month to re-engage or to stay engaged with the Red Cross, whether it's volunteering your time, whether it's donating blood, whether it's making a financial contribution, or taking a course such as a CPR course or swimming lessons.
You do a lot of good work everywhere. The situation in Haiti, can you give us just an idea of the scope of this disaster that struck Haiti?
Our president, Gail McGovern, was down there within a week of the earthquake, and she describes it as just the buildings were just pancaked. The devastation, as far as the eye can see, very little standing. The American Red Cross had a presence in Haiti before. We had 15 people there working on various programs. The building that they were in, the face of it fell off. You could look right into the building and see the offices where they were. So they clearly couldn't work there anymore. And they were working in an area on the street right outside and trying to provide help in the immediate aftermath. First aid. They had a truck and they used a door that they used as a stretcher, and they were taking people to the hospital.
Wow. A disaster of this magnitude, where do you begin? What do you do first as far as the Red Cross?
It is an amazing disaster and very large, and I think the first thing you try to do is as our people on the ground did at the time, was to deal with the most immediate needs. That's if people needed medical help, they gave them medical help. It was first aid, taking them to the hospital, and then you have to deal with food and water. Shelter is another thing. Right now we're still in a situation where many people are have tarps or blankets strewn over things. We know in terms of a long-term basis that we have to get people in better shelter before the rainy season begins and before hurricane season begins.
Wow. How can people help the Red Cross help the people in Haiti? What's the best way?
I think the biggest thing remains cash is king in these sorts of things, because it's so easily, a donation made here today can be so easily gotten to there. So it's whether it's going to 1-800 Red Cross, whether it's www.redcross.org, or whether it's texting $10 to Haiti, 90999. Those are all things that can be done. Many people have asked us in the past about, do you accept volunteers to go down there? Do you accept gifts of clothing or materials? And it's just so difficult in terms of logistics there that we're only sending in experienced volunteers who are Red Cross trained. And the logistical nightmare of taking some, imagine a truckload of pants or tennis shoes that are collected in Iowa. How do you get those down to Haiti? How do you get them distributed? And it's so much easier if we have a financial contribution that you can use to buy and then distribute the goods.
You mentioned about texting donations. Tell us about that. This is something that has really happened with the Haiti disaster that you've never seen anything like before.
You are exactly right. The text Haiti to 90999 is one of the most amazing things that's happened. We have raised $32 million, $10 a pop through that. The previous record, Congressman, was $460,000.
Wow.
So, and the people of Iowa have responded to this. I checked before I came over, and more than 225,000 Iowans have done this, or 22,000 Iowans have raised $225,000, and it's truly impressive. And to get that amount of money, as I said, $10 at a time is I need to find a new word for amazing and overwhelming.
I was visiting with your director in Ames last week, and a lot of people, young people especially, don't really write checks all that often. They don't do it. So this is something that really makes it easy for them to be able to help.
It does. I have two 20-something children, and both of them made donations, and both of them have mobile devices molded to their hand, and it's so easy because you don't have to give a credit card number. Right. You don't have to call and do anything. And so it's just punch that number in, you made a $10 donation. I will say, as generous as people have been through the text donation program, we're still getting most of our money through online donations, and we are incredibly grateful. And corporations and businesses are supportive. I know that the Hy-Vee stores in Iowa have been collecting donations from customers, and things like that are happening all over the country, and the generosity and the outpouring support is by the American people is really, we're really grateful for it.
Getting to Haiti again, what role now? I mean, this is somewhat after the initial disaster. Things have somewhat stabilized, I guess. But what's the role of the Red Cross at this point moving forward? We're still in an emergency response,
but we'll be there both in this emergency response stage, which could last several more months, and then in a long-term recovery, because it is physically impossible to build enough permanent shelter between now and the beginning of the hurricane season. Among other things, there's all this rubble spread across, and you have to figure out, you have to clear the rubble, you have to. And sadly, there may be still remains in some of that. You have to respectfully take care of that. You have to determine who owns that land, because you can't just suddenly build all these buildings and stop with something else. And it takes the time to build that building. So we'll be working on that for a long term. I think by comparison, the tsunami that struck in the Indian Ocean 5 years ago, we're still there and still finishing up some projects. We're going to be finished up in the next 3 months, but we're still finishing up there. So we remain there to work on long-term recovery as well as immediate response.
How are the Haitian people reacting? I mean, is the morale high, or do you know what on the ground how they're responding to this? It's devastating.
One of the things that our president and CEO Gail McGovern said when she got back from Haiti, she was amazed at the patience and the attitude of the Haitian people. They were not crowding around. If they saw a Red Cross truck coming through a neighborhood, they would clear the way. They cleared the streets so the trucks could get through. I was talking with one of our volunteers on the ground there, and spoke of the children. 40% of the population of Haiti is children, and how when he's going through a camp, and Matt is 6'4", and these little children come up and grab his hands. And another volunteer that we had there was talking about hearing children laugh. and knowing that they played. I mean, they're trying to get their lives back to normal as much as they can. And she said that the laughter was a sign for her that you know, that people were, that Americans, or the spirit of the people was coming back.
Is there anything that made Haiti especially vulnerable to a disaster like this compared to other places?
Well, the fact is that earthquakes are very, very rare in that area, but it's a very congested city. The buildings were probably not built to code, and so it's even worse when you have a devastating earthquake in a place like that, because the buildings collapse and forcing many people to either live on the streets or leave the city.
And it's one of the poorest countries in the Western Hemisphere to begin with. Do we have a number as to the final death count, or do we know exactly yet where? I
don't think we know exactly yet, and I will say that the Red Cross doesn't do death tolls, but the government the latest government figure that I saw was 217,000, which is truly a tragedy.
Yeah. Do you think Haiti by itself can they make the recovery? I mean, the poverty level that they have. We can talk about the government there. It was not the best functioning government probably to begin with, but are we going to be able to rebuild and to get back to normal life again?
Well, times were tough before,
right.
So their normal was not very good. But there is an opportunity here to rebuild the country, to rebuild the infrastructure, to rebuild the communities in a way that they're more sustainable, that they can resist any future earthquakes or any future hurricanes. So there's an opportunity there. I think the world community, including the United States government, the Red Cross societies from across the world, the United Nations, are all coming together. And we saw, I mentioned a moment ago, Congressman, the tsunami. If you go back there now 5 years later, there's a lot that's been done, and you can really see where there was devastation across. There's now communities rebuilt. Communities have been strengthened in terms of they have tsunami warnings, and they have drills. And there are places where before they couldn't make it up the hills, there have been steps cut into the hills so that the community can go back. So that not only are it's not to where they were before the tsunami, it's better than it was. And I think that should be the goal that we should all have for Haiti.
And is there any timetable as to get back to some semblance of normalcy there?
If there's a timetable, I don't think anybody knows what it is yet.
Yeah.
It is. The devastation is still widespread, and I think we're still trying to figure out, as are others, what it actually is going to take.
You mentioned before the world community has stepped up. I mean, the United States, I think, has been in the forefront. Obviously, we have the resources, military assistance, all of those type of things that help also. But have there been other countries in particular, you know, France has a close tie with Haiti. Have there been other countries that have really stepped up, or your branches across the world?
There are 30 different Red Cross and Red Crescent societies that are in Haiti right now. More than 600 people total that are in there. And I think the important thing to remember is when a disaster like this happens in another country, that country's Red Cross is the lead. We wouldn't, if there was tragically, if there was another flood in Iowa, you wouldn't want a Red Cross society from another country coming in and saying we're in charge.
Right.
So in Haiti, the Haitian Red Cross is, and so there are probably 2,500 Haitian Red Crossers who are delivering the services to the people, which makes more sense because it's neighbor helping neighbor. And so I think that's been sort of the model. But the international Red Crosses, including the American Red Cross, are there providing logistical support and providing the supplies and the materials to help the people of Haiti.
How many Americans have gone down to help with the Red Cross? I mean, there are thousands of Americans that have gone down to be of assistance, but just through the Red Cross.
Through the Red Cross, it's been about 100. And that includes, one of the things that we had a unique role in, is that when the U.S. naval ship Comfort went down, they needed Creole-speaking volunteers to serve on that ship. So we had about 75 Creole-speaking volunteers that we got from Red Crosses through the Red Cross, and they stayed on the ship, they translated, they helped out. It was probably something that some of them hadn't expected, because they were right there, and sometimes not assisting in operations, but there because you need to communicate in Creole to the folks. So we did that. We did that for the first month, and it was an amazing experience.
Were most of them from Louisiana or from?
Some of them were from New York, and they came from across the country.
That's really, you don't think about that, but the language barrier, and certainly in their dialect actually that they have in Haiti. But is there any difference between the situation in Haiti and maybe other disasters in particular? When you talked about the tsunami, but unique challenges in Haiti compared to other places, do you think?
What's been described to me as one of the challenges of Haiti was just the sort of the urban infrastructure. The tsunami in Asia that happened 5 years ago was more along the beaches and in that area. To have it hit in an urban environment, so the port was essentially knocked off of service. You had one runway. The roads were covered with debris. The buildings were falling. The water systems weren't working. The sewer system's still not good in many cases. I think the urban environment made this one even harder, which is why I think the emergency phase is going to take longer than normal, and I think the recovery period will take even much longer.
I mentioned earlier about the government in Haiti. It's obviously a very poor country. The government had some problems before. They were making some headway, but there was physically, the government buildings, the palace, everything was destroyed basically. So, do you assist the government itself, or with expertise, or how does that work to get them up and operational again?
We don't go in as consultants to the government. There's sort of the lane for the NGOs. And for the Red Cross and the Red Cross societies, we sort of work we're working very closely in tandem with other Red Crossers, and I think what we want to make sure that we're doing is that we're doing this in what you want to have close coordination with all the groups. You don't want the UN or the U.S. government or the Red Cross or Doctors Without Borders, UNICEF, or any of these other groups many groups that are working together to send 5 trucks to the same neighborhood, all loaded up with water, and then have nothing go to another neighborhood. So I think they're even working to the point where they have GPS systems that they're trying to coordinate, who's going where, so that the idea is to get as much aid to as many people in the most efficient way, and we're trying to do that.
There's a lot of stories, and everybody sees the children that are suffering. A lot of them probably lost parents or don't know where their parents are. Does the Red Cross work specifically, or have any programs designed just to help the children themselves, or is it all-inclusive in everything that you do?
Well, we focus a lot on the children. One of the things that we've done that the Red Cross has taken a lead on is a vaccination program, because we're really worried about long-term disease. Given that sanitation is not very good, there aren't enough latrines. So we started a vaccination program, and already there have been 15,000 children vaccinated. We have a family linking program that we work on that I know that you've already got a link on your website, and we appreciate that's being done to sort of make the family connections, that if someone's missing, they can register on it. And we've taken volunteers with cell phones into places and just had people phone in and make sure that they're registered. And the fact is, you don't necessarily measure the number of names on that list, because if you make a connection with your family, you actually come off the list. So that's been one of the things. But we've worked on it from that standpoint. I'm going to anticipate a question you may ask. We don't do adoptions. That's not the Red Cross does a number of things, but adoptions is not one of them.
Okay. What sort of you talked about vaccinations, but there's the health issues, there's sanitation. You mentioned before about the sewer systems and all that. Do you work specifically on those type of issues? The vaccinations are very, very important, but how do you assist the people there as far as the health issues beyond the vaccinations?
We've got the Red Cross writ large, not just the American Red Cross, but the other Red Cross societies that have mobile field hospitals. I think they're serving 1,000 people a day already. I think it's just there's a you talked a moment ago, and you were asking about what the different things are. And so we've focused. Our lane has been a little bit more food and shelter, or food and water, long-term shelter. The Red Cross will have a major role in that. That's sort of one of the things that Doctors Without Borders has its level. Shelter is one of the things that we'll be working very closely on. Long-term assistance, trying to figure those things out. Health and family services. We do work on linking not just children but families together. And you asked a moment ago about we talked a moment ago about shelter, and one of the things that's happened is that a number of people, probably 500,000, have left the capital city area. Some of them have gone out into the outlying area, and they're staying with friends and family. Relatives. Some of them have found an area outside the city where it's a clear area, and they're setting up little communities there. But I think there's one of the long-term issues that we're trying to work on is you want to build a community that works for people, but you also don't want to be too far away from their jobs, from their other family members, because no one's going to want to move out into the suburbs if their job's downtown. And the rest of their families down there. So we have to sort of work on that, and that's one of the things we're trying to assess when we're talking about long-term housing issues is what's the best thing, what are the needs, who needs it? Because some people, if they're living with relatives, they may not need an immediate situation, they may not need a tarp or something like that, but they may need some sort of assistance to help them stay in that situation. So we're trying to assess all of those. We want to be smart about the way that we're doing this. We also don't want to come in and dictate. We want to listen and assess the needs and figure out what's best for the people of Haiti. Instead of dictating it to them, we want to listen to them.
Are there bureaucratic problems in Haiti? I mean, would you always run into government bureaucracies, red tape? Are there anything that is holding you back from helping more people?
I think the biggest thing we faced, and it has nothing to do with bureaucracy, was that initial stage of where there was so much aid that wanted to get in and one runway to do it. And there was an overland route that you could come in from the Dominican Republic, but the problem is if you have truck after truck on that, even that starts to get congested. And the roads were not good to begin with because they were covered with debris. The good news is the airport's up, the port is functioning again, the road is done. So one of the people at the Red Cross who was there said initially the pipeline was about the size of a straw, and then it got to be the size of a garden hose, and now it's like a fire hose. So the logistical problems are getting smaller and smaller, but the need is still immense.
Yeah, you mentioned your lane or what you do specifically with the Red Cross, but there are other groups there, obviously. Who coordinates all this, and how is there someone overseeing everything so that there isn't duplication of efforts? Is there practice from previous disasters, coordination of these things?
I think different groups, groups have learned to work together because a lot of times you have the same groups responding to these disasters because of the expertise that we have, and we want to work together. Certain areas they'll have a person in charge. I think at this point in Haiti, I know that I think the groups are still working sort of in coordination with each other, and there's still maybe a question as to who's actually in charge.
Do you have any idea how long you'll be in Haiti? I mean, is it until the job's done?
It is until the job's done, and I don't think we know yet. I really don't, because we were talking about that in a meeting at the Red Cross the other day, and it's just that the American people have been very generous in their support to the American Red Cross. If the money's designated for Haiti, we're going to spend it in Haiti, and it'll be there as long as it's necessary. With the tsunami, we raised $581 million, and that was what we spent. And as I said a moment ago, we wanted to be thoughtful about the way we did it, and so we had $110 million in short-term emergency recovery in the first 6 months, and the rest of it was spent over time, helping rebuild and come up with better programs and help them be better prepared for the next one.
Do you have any idea what the life of a Haitian is today in these camps, if they're outside, away from their homes or whatever? I mean, it's got to be just unbelievable as far as the uncertainty for their future. I mean, they're looking for basic needs all the time, but is there what kind of hope do they have right now as an individual Haitian there?
You know, I can't sugarcoat it. It's tough there, but there are signs of hope, and that's been clear for everyone that's gone down there. There will be jobs at some point. Some of the stores are starting to open again. I was told an interesting story about what someone did who just came back, said that some children had gotten a car battery, and they had it hooked up in a way that people could charge their cell phones. Because not everyone, but a large number of people in Haiti have cell phones, but if you don't have power, you eventually lose your charge. So they had gotten a car battery. Car didn't run anymore, so they were going around and for a nominal fee were charging phones. I thought that was sort of an interesting entrepreneurial spirit. But you know, people are there are signs that the grocery stores are opening again in some areas, and people, or the markets, and people are, so it's going to take a long time. But you know, life is coming back, and as I mentioned earlier, you know, I'm thinking of the young volunteer that just came back after a 3-week deployment, and she said the laughter of children that she's hearing again is a sign of hope.
That's good news. President Clinton and President Bush have this initiative as far as Haiti. Does that affect the Red Cross at all, or some of any of the benefits or the funds that they raise? Will that be channeled through the Red Cross, or is there coordination with
there?
That?
They're part of the aid groups that we coordinate with. You know, another example was the telethon. We've made applications for grants from that. I think they've given out about half the money. We got some of that, and so it's, you know, we're all trying to work in partnership on this, and there's plenty of need to go around.
Well, I think people have, because of your efforts, and they look to the Red Cross as being the place where they can, with confidence, donate to make sure that their dollars are well spent, or any kind of contributions they make. So it's a real pleasure to have you with us today, and keep up the fabulous work that you do all around the world, and particularly in Haiti, in this catastrophic event that they have down there. So thank you very much, Roger, for being with us.
Thank you for having me
here. The tragedy in Haiti is almost unimaginable in its scope and its horror. But we can make a real difference by making simple efforts to ease the suffering. Rebuilding the country will take a long-term effort, and it's my hope that the United States and the world community will be there every step of the way. I want to thank my guest one more time, and thank you for joining me. And I hope you'll tune in next time on the Congressional Report.
From the nation's capital in Washington, D.C., this has been the Congressional Report with Iowa Congressman Tom Latham. Have a question, comment, or concern? Congressman Latham wants to hear from you.